The project that I presented at Indaba was my thesis project, Maternal Home Care.
6 million Canadians, or 1/5 of our population, actually lives in rural or remote areas, and 17% of that group takes over 2 hours to access a hospital.
Maternal Home Care is a project, and it's a system of products and an app that all help women who are at high risk of developing preeclampsia monitor their health condition and be able to provide objective information about symptoms that they have.
I formed this empathetic testing suit so I could spend the day to simulate some of the feelings of being 30 weeks pregnant based on the size, based on the weight. And I brought in a number of tools that you would use to do this testing. And I started to learn some really interesting things. I started to use pH strips, which are used to measure various conditions in urine. And based on this, you're trying to match a tiny square, and it's changing color, and match it to another tiny square, and make sure that those colors are the same. And that's how you indicate what your condition is, or if you're at higher risk.
It's especially important for women who live in rural Canada who might have a more difficult time accessing reliable healthcare, and allows them to more independently monitor their own health. Antenna, broadening your horizons and the scope of what you see design as, and being able to understand that outside of the context of your school, outside of the context of your normal networks, it's such a fun group of people, and there's been so much learning from other people in the team, and it's been amazing just to connect with other creatives and see the kinds of amazing work people are doing in very different faculties in different areas of the world and the problems that they're tackling. There is a huge world of design that's left untapped, and you can continue to reach out and try to collaborate and work with others.